Introducing mechanical behaviour of bones breaking. Bone is a living tissue. Every change of position results in some type of force being transmitted through your bones and joints. Forces applied to bone tissue help to shape its strength and density. However, if too much force is exerted on bone tissue, it can break. Broken bone, also called a fracture, is when a break goes through part or all of the bone. For the purposes of this animation, we will refer to broken bones by their medical term, fractures. A fracture occurs when there is more force applied against a bone than the bone can structurally take. Falls, accidents, and sports injuries can twist bones with great force, which can lead to pain, loss of function, and sometimes bleeding and injury around the site. Understanding bone structure. Bones are made up of a framework of a protein called collagen, with a mineral called calcium phosphate that makes the framework hard and strong. Calcium phosphate gives our bones their stiffness, whilst collagen gives our bones their toughness. Bone stores calcium and can release calcium into the bloodstream when it's needed by other parts of the body. Most bones also contain bone marrow, where blood cells are made. As calcium is stored in the bones, certain vitamins and minerals that you eat, especially vitamin D and calcium, directly impact how healthy a bone will be. Healthy bones are not determined by their strength, as you may assume, but it is the ability of a bone to be flexible, which impacts the strength of the bone and in turn impacts a bone's strength. The flexibility of a bone is therefore a critical factor when it comes to both fracture and osteoporosis prevention. A bone's flexibility is largely determined by its fluid component, so it makes sense that if our bones are dehydrated, they are more susceptible to breaking when they are exposed to stress. Together with collagen and calcium phosphate, the extracellular matrix of a bone exists as an aqueous solution. As up to 90% of this extracellular matrix is made up of water, not only does physical activity and the food you consume play a role to improve flexibility of bones, but so does overall diet, including drinking more water. So what causes bone fractures? In younger people, fractures usually occur from traumatic incidents, such as a fall or accident. Sports injuries can also cause fractures when excessive force occurs, such as awkward landings or repetitive motions during play. Fractures can also be caused by diseases that weaken the bone over time, such as osteoporosis. Osteoporosis is a bone disease that develops when bone mineral density and bone mass decreases, or when the quality or structure of bone changes. This can lead to a decrease in bone strength that can increase the risk of fractures. Osteogenesis imperfecta, OI, is a genetic medical disease that also affects the strength of bone, causing bones to fracture easily with no obvious cause or minimal injury. Unfortunately, there is no way to prevent OI, as it results from a genetic condition that causes the body to not make enough collagen, resulting in weaker bones. What is the anatomy of a fracture? Initially, when a fracture occurs, it will be classified as open or closed. Open fractures are also known as compound fractures. This is where the bone pokes through the skin and can be seen, or a deep wound exposes the bone through the skin. Closed fractures are also known as simple fractures. This is where the bone is broken, but the skin is intact. Fractures can also cause damage to surrounding soft tissue, including muscles, tendons, ligaments, and blood vessels. Fractures can impact nearby nerves, causing pain and numbness, and trigger an inflammatory response that leads to swelling and redness. This is why they hurt. Fractures are considered a medical emergency requiring a visit to the emergency department. A fracture in a child is likely to be what the surgeons call a green stick. This kind of splintering and bending occurs when a bone cracks on one side only, not all the way through the bone. Stress fracture is another type of fracture which we see more commonly in athletes. Hairline fractures are the most common form of a stress fracture. often occurring in the foot or lower leg as a result of repeated stress from activities such as jogging or running. Once a bone is fractured, it can take around 4 to 8 weeks to heal, depending on the age and health of the person and the type of break. Medical treatment and recovery. A fracture is typically investigated by a doctor when there is pain, swelling, bruising and/or discoloration, weakness in the limb, difficulty in moving the limb, or an unusual shape forming at the limb. In most cases, an X-ray will be sufficient to confirm a diagnosis of a fracture. However, in some cases, a bone scan or computed tomography scan, referred to as a CT scan, will be required. The type of fracture will also need to be diagnosed by a doctor, as the treatment will depend on whether the fracture is mild or more severe. Treatment for a mild fracture might range from wearing a cast or splint to keep the area still, so the bone can heal properly. This can last for several weeks. More severe fractures may require surgery to realign your bones. Often you will have to undertake what is known as rehabilitation, which includes physical strengthening exercises that promote correct bone alignment, as well as stretching exercises to help with your recovery. So now we understand more about the anatomy of a fracture and the impact fractures can have on your body. What are some things you can do to prevent a fracture from occurring?